Across GV Health's local public health unit, there's 504 active cases of people with COVID-19 at the moment. In the Shepparton local government area, there's 387 active cases, and in the last 7 days, there's been a total of 166 people testing positive. In the last 2 days in particular, those numbers have been in the order of around 15 to 20, whereas the numbers in the previous days have been around 30 to 40 people per day testing positive. So hopefully that trend continues, but it's a bit early to say whether or not it is in fact a trend, but of course it is something that will be continued to be closely monitored. There's 13 patients in GV Health at the moment with COVID-19. One of those people is in intensive care, but that person isn't on a ventilator. Unfortunately, we're still seeing a number of examples where people are putting off getting tested for COVID-19. So it's not uncommon for our contact tracing team to be hearing that people are leaving it sometimes up to 3 days before they go and get tested. And that means that during that 3-day period from when the symptoms started to when they actually get tested and then isolate, that represents an opportunity for them to then be transmitting the virus around the community through their households, workplaces, and a number of different areas. So again, the simple encouragement is that as soon as you get any symptoms of COVID-19, you should come forward and be tested straight away. There's still plenty of testing capacity available at GV Health's facilities, at the respiratory clinic in Graham Street in Shepparton, at the drive-through centre at the Shepparton Showgrounds, and general practices are also providing testing as well. So there's plenty of access right across the Shepparton area and across the whole state as to where people can get tested. So the Department of Health website, coronavirus.vic.gov.au, has a full listing of where all of those testing sites are. So as soon as you get symptoms, come and get tested. Generally the wait times are very good, there's not much of a delay, so as soon as you get symptoms, come and get tested straight away and don't delay it. So in regard to vaccination, we are in a really good place now across our local public health unit. So the area across GV Health's local public health unit has now administered 155,000 doses of COVID-19 vaccine, and I'd just like to thank all of our partner health services from the towns in and around Kilmore, Seymour, Mansfield, Benalla, up around Cobram, Numurkah and Nathalia and Kyabram. They've all done a terrific job to reach that milestone, and of course GV Health staff as well. At the Macintosh Centre, we've now administered over 80,000 doses of COVID vaccine, so that's a terrific result. We've now had a number of weeks where we've been over 95% in terms of our first dose, and pleasingly, as of the data that was reported on Monday this week, we now have exceeded the 90% double dose mark for second vaccine. So that's really encouraging. In Shepparton, that number's around 91% of people who are doubly vaccinated now for COVID-19, which is terrific. And also right across our area, all but one local government area has exceeded 90% on their double dose as well. That local government area that's a touch below 90% is Murrindindi, and hopefully in the next couple of weeks they'll reach that milestone as well. So pleasingly we're moving forward in a really encouraging fashion, but there is still a small number of people who haven't been vaccinated for COVID-19. So again, if you haven't been vaccinated and you're unsure for whatever reason, please make sure that you rely on reliable information on the Australian Government, Victorian Government websites about vaccination. It's much better to rely on credible sources of information than perhaps something that you may see on social media, but we really want to encourage people to close out that last remaining handful of eligible people to be vaccinated because it is the best way to reduce the spread of COVID-19, but it's also the best way if you do happen to catch COVID to end up in hospital or in intensive care. So if you haven't been vaccinated, please do so as quickly as possible. One other quick thing in relation to rapid antigen tests, which are now starting to become much more commonplace and available in different settings, which is terrific. Just a note there is again on the coronavirus.vic.gov.au website some information about rapid antigen tests, but rapid antigen tests shouldn't replace a PCR test. So a PCR test is those tests where the swabs are used in a person's nose and in their mouth and throat. Rapid antigen tests don't replace the PCR tests. They're a first step, if you like, and indeed anyone who has a positive result on a rapid antigen test should then proceed, they should isolate immediately and then also go and get a PCR test at one of the drive-through locations or clinic locations around Shepparton or around the state. So rapid antigen tests are good, but it is a first step and they're going to be used for some specific purposes in the not too distant future. But happy to take any questions from here.
Have you seen a trend of people replacing rapid antigen tests with
they're being used in certain settings, certain workplace settings. It's not far away, I believe, that they'll be introduced in schools, but it's still early days in relation to rapid antigen tests. I think they will be an important part of our whole living with COVID response in the not too distant, well, they already are, but more so in the not too distant future. But again, it's like a screening test, if you like, in some respects, and people should still get a PCR if they do have a positive rapid antigen test.
The next milestone being getting the 12 plus population past the 90% vaccination rate.
Yeah.
Will there ever? Do you know whether there'll ever be data for Greater Shepparton about how those 12 to 14-year-olds are going? I haven't seen it published publicly as yet, but what I do know is that there's been some really encouraging uptake of vaccinations in, initially of course it was open to 16-year-olds and then to the 12-year-olds. There's been some really quick and encouraging uptake in and around the 70-odd% quite quickly for first dose in the first few weeks. That's moved pretty quickly to around about 80% in subsequent to that. So the exact numbers I'm not sure of, but what I have seen in terms of some other reporting internally is that it's really encouraging, and of course that's a good thing because we do know at the moment the transmission that's occurring there is a large amount of transitioning still in school-age children, so that's where we are keen to again get that wider coverage of vaccination for school-age children once they become eligible and once the vaccines are approved for use in those age groups. And in the past you spoke about how rather than focusing on daily data, looking at 7-day trends in Victoria but also in our area is important. Have there been any trends in hospitalisations or case numbers with those 7-day averages that you could tell us a bit about for our community?
So our number of patients admitted to GV Health has been pretty constant at around about 10 to 12 per day, and we have had around about 2 to 3 patients in ICU during that period. So that's not only in the last week, that's been really across the since we had that other outbreak in August and into September. Our inpatient numbers really haven't decreased significantly since that period of time. And in fact, we've relocated our respiratory ward to have some more capacity to admit patients as part of it was always part of our plan to do that at this stage. And that was really based on what was being shown in the Burnett modelling in terms of increased projections in terms of hospitalisations and patients needing intensive care as well. I think it is much wiser to look at the 7-day average than a 1-day average. Like I mentioned before, you can have a 1 or 2 day period where you might have lower case numbers than the previous days, but the 5 days that I spoke about before, that the numbers of cases were consistently in and around that order of 30 to 40 new cases a day. So a 7-day lens or even a 2-week perspective gives, I think, a better insight to where things are moving from active cases point of view.
You mentioned increased capacity through the move. Can you tell us more about that?
So it's part of what we have done in terms of our inpatient capacity relates to some works that were due to occur always in terms of our redevelopment of the site here at GV Health at Graham Street. We were using part of a ward that for respiratory patients with COVID that needed, that part of the ward did need to be upgraded as part of the ongoing refurbishment program. So that was always due to occur at about this time. So what was also due to occur was the move into our new child and adolescent ward, which is above the emergency department. So we've taken the opportunity to use some capacity that was created where the former children's ward used to be. We've got a nice contained area there where we can admit COVID patients, and it's also given us the chance to increase our bed capacity. But it's also, and this is the thing with operating and running health services, it's a constant juggle. It means that we can, by doing so, continue that juggle to allow us to have the redevelopment works to continue as well. So there's a few things that we're trying to balance and in and around a COVID outbreak and a redevelopment, but always we will be focused on ensuring that whatever we're doing is safe for patients and staff, and that's been the case throughout this. But that capacity is certainly welcomed, and it means that we can also have some more surge capacity for COVID patients in that same area as well, which is important should we need that to occur.
How many beds maximum could that cater?
We could go up to 24 there, but we've got contingency plans to use other wards if we needed to. But at this stage, it doesn't appear that we'll need to do that. I think we're placed at the moment. We've got a good amount of beds, inpatient beds, to be able to manage the current demand for COVID patients, and our ICU as well is managing with the COVID positive patients that we've had as well.
And finally, are you seeing a trend in terms of the vaccination status of people who are showing?
Still much the same. The vast majority, I don't have the exact percentages at hand, but the majority of people, in fact the vast majority of people who are admitted with COVID-19 are not vaccinated, and then a very small number may have had one dose. But last time I did look, it was in the order of 85 to 90% of people who are admitted with COVID-19 aren't vaccinated. So that's, again, the really important thing for people to do if they're not vaccinated, to get vaccinated as soon as possible.
This is something you've explained before, but every day we field questions from people who want to understand why case numbers may remain high when our vaccination rates are so high. Could you explain again, why high case numbers is to be expected at the moment?
Yeah, so I think one of the main reasons, one of the big differences at the moment and indeed into the future is that in days gone by we were able to perhaps contain the movement of people through lockdowns, and that meant that people weren't interacting in social settings, workplace settings, even being able to go and visit people in their home, which can happen now. So in terms of why we've seen a greater number of cases, I think it's because there's movement of people in schools, education, early learning settings, different workplaces, and socially as well. So I think opening up hospitality, cafes, retail has had an impact on the total number of cases, and that was always predicted to be the case. So, but the main difference in terms of following on from having lockdown settings eased is it now means that with greater rates of vaccination is that there's a higher degree of safety for people in the community in terms of in terms of a broader amount of immunity that exists in relation to that. We're still going to see positive cases because, as I mentioned before, there's still a number of people who haven't been vaccinated, and we should expect that there will still be transmission. We're working pretty hard to get the vaccination rates up into some of those more hard to reach communities, and that's why the second bus vaccine is really important, and other strategies that the state government has in place to boost up vaccination. but it will continue, I think, to be, you know, certainly through till Christmas. We should expect probably to have several positive cases, you know, perhaps in that order of 200 to 300 in our area, at least for the next couple of weeks, and then reassess that in December about what the rest of December looks like.
Awesome. Great, thank you.
Thanks.